Hello, good evening. Welcome, my dear students, for today's class 5 of my crash course in medicine. Uh, we were planning to have 45 days non-stop, including Sundays classes, but then I don't mind taking a couple of more if anything is missing. Uh, okay, welcome all of you. Good evening. Today, we are going to start the respiratory system. Respiratory system uh, 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 diseases. Okay. Uh, just to introduce, respiratory system, like your renal system, is a blood purifying system. It is a blood purifying system, which means like kidneys. Kidneys, what kidneys do? They remove the waste products of the body every time. Same thing does the respiratory system. It removes the carbon dioxide and takes in the oxygen. So it is a blood gets purified by oxygenation. This is called oxygenation of the blood. The lungs receive deoxygenated blood. From the oxygen that we breathe, the lungs oxygenate the blood. So this is called a blood purifying organ or system. So as you all know, you have learned in anatomy and physiology, the system of respiration, the respiratory system starts from the nose to the last tip of the acini, alveoli, acini. So that is the entire respiratory system. So each part can get involved in the disease, and each part will have different problems, different signs and symptoms, different treatment modalities, different investigations, different investigations. So let us quickly see what is the anatomy of the respiratory system and what is the gas exchange that takes place in the lungs. Respiratory system usually we divide into two, upper and lower. Upper respiratory tract, lower respiratory tract. Okay, upper means it is from the nose to the trachea. From the nose to the trachea is called upper respiratory tract infections. The division is very important in clinical point of view because most of the upper respiratory tract infections are viral, self-limited and mild, like common cold, coryza, pharyngitis and throat pain. They're usually benign diseases. They last for few days. They don't need much treatment. But the lower tract infection, lower respiratory tract infections are little more serious and they need proper diagnosis, investigation and treatment. So right from the body is a super computer. Body is a super computer. Nobody can make even after thousands of years. So the God has given so many things, so many mechanisms, millions of micro mechanisms that go on in 24 hours in our body. Right from the tip of the nose, there is a protector because this system is completely exposed to the outside atmosphere. Whatever we breathe, without our consciousness, we breathe so many millions of unwanted, dirty dust particles that we cannot even see. So there is a filter mechanism right from the tip of the nose until the functional unit of respiratory system, which is the alveolus or acini. So right from the nose, the nose, the hair in the nose, they filter the bigger particles and they don't allow these particles to go inside the system. So from there, even the anatomical pathway, the nose is not just a one tube, it's a tortuous one. It goes up and goes back and then bends down. This tortuosity, the position, the track of the upper airway itself is a protective. It prevents so many things that going from entering inside. That is one thing. Then there are a lot of protective mechanisms. The mucus that we have in the entire respiratory system is a very good barrier of infections. It traps the unwanted particles, including bacteria, virus, and dust particles. And because of the ciliary action, the ciliary action is continuous process. They try to drive the waste products, unwanted foreign particles out in a 24-hour basis. Though the mucus, which is a micro thin layer, which is spread over entire surface of the respiratory system, we secrete about 100 ml of mucus every day. If you there are some millions of acini in the lungs. If you open each acini and keep it on a ground, the whole thing occupies one full football ground. That is the exchange area for the gas. You can't imagine. So if you take out one acini and spread it over a ground, it occupies one football ground. That is the exchange. And this 100 ml of mucus, which we secrete, it's spread in the entire football ground about 40 feet into the 60 feet or whatever it is. So it is a micro thin layer smeared over the entire epithelium, which is covering the system. So that is an amazing aspect. So mucus itself is a protective mechanism. There are some diseases where the mucus production is less. So we if the dryness is there, many diseases. So there are some diseases. It will invite infections and all those stuff. So right from there, the cells, the macrophages, the neutrophils, the eosinophils, these is a cellular mechanism which prevents, and hormonal mechanism, and so many other protective mechanisms play a role in preventing the diseases of the respiratory system, because this system is exposed to environment from outside, which contains a lot of unwanted, seen, unseen particles. Okay. So that is the protective mechanism. That's the immune system. In the respiratory immune system is a different thing. And you have the surfactant. You have so many things that if you read physiology, you'll understand. It's a big chapter. Immune system of the respiratory system. That's why we don't get usually, though we are exposed to so much of dust and other unwanted things in the environment, we don't get infections very commonly. Even if infections come, they're usually limited to upper respiratory tract, because the immune mechanism play a role and prevent the infection from spreading down into the alveoli. So whenever you are talking about diseases of the respiratory system, we talk about diseases in the airways, diseases in the parenchyma, diseases in the pleura, diseases in the blood vessels. These are the four parts of the respiratory system can have diseases. Namely, I'll repeat again, airway diseases, parenchymal diseases, pleural diseases, and vascular disease, arterial, venous, veno-occlusive disease. So basically, these are the only things. Of course, there are mediastinum. I'm not talking about that. Mediastinal lymph nodes, mediastinal tumors. Those are different things. So basically, lung has only these four areas where these can get disease, infected, or any other disease.
So parenchyma also includes interstitial.
Sorry?
Parenchyma includes interstitial diseases.
Yes, I'll come to that. I think I'll go to the whiteboard. I'm happy all of you are there on Sunday evening. So I'm also continuing on Sunday because I want to finish off within the stipulated time. So I request all of you to please be regular, so that I don't want you to miss even one class. Okay, coming to this. So this is the base general diagram. This is the trachea, the bronchi, that is the lung, this is the pleura, this is the heart. Okay, heart is situated 2/3 to the left and 1/3 to the right. So just like that.